Hello, everybody, and thank you so much for joining us for this month's Thriving Thursday, where we're going to be talking a little bit about consumerism. What I would like to do before we get started is introduce myself. My name is Sarah Norton, and I am the Wellness Specialist here at Gatehouse Media. I do want to have full disclaimer here that I am not one of the benefits specialists here at Gatehouse Media. I did partner with the benefits group to get some of this information, but really what I want to make sure that everybody is aware of is that the information that we're going to be highlighting today is primarily a high-level overview of certain things, certain topics, so that you can have a better understanding of different ways you can try to save money and be educated when you go in to talk to some of the medical professionals. But if you are looking for any specific detailed information pertaining to our benefit programs here at Gatehouse Media, please visit our benefits portal. That's where you're going to find a whole host of information. So I just wanted to make sure that everybody is aware that this information is really just a high-level overview. And also just be on the lookout for information that'll be coming in the near future, regarding benefits and making sure you're understanding everything as we move forward. So with that being said, you may have signed up for this program and said, well, what is consumerism, right? And so really when we're thinking about consumerism in general, not just pertaining to healthcare consumerism, but consumerism is really understanding you do have options, knowing what kinds of questions to ask, and really having some sort of idea of where you can go to get help. And the trick is we are being asked to be more educated and more involved healthcare consumers, but it's not like that's really very easy. We're all accustomed to, if we need to buy a washing machine or a refrigerator or a car, we have things like the internet, consumer reports, even just like other people's reviews to like try to help us make decisions and know what kind of questions to ask. But there really aren't those kinds of resources available for healthcare, and that can get kind of frustrating because, again, we're being told we need to be better educated healthcare consumers, but doing the research and trying to get the information really is not all that easy. And it might seem like it should be one of those things that should be easy. It's like, okay, well, if I go out and buy a washing machine, I know that if I get washing machine X, it should cost me about this much money. And so if I see it's being sold at different places for different amounts of money, I know I have options. But with healthcare, the funny thing is a lot of times you might even have your doctors or, the hospitals might not even know how much they're going to charge you. And it's not because they're trying to be sneaky or, pull one over on us. It's because they, medical providers and facilities are, reimbursed by insurance carriers. Insurance carriers are going to negotiate different rates and different, try to get people into their groups and do different things. So there's not a one size fits all, unfortunately, kind of approach to how we are charged for medical services. So we could have two different people, that are covered by the same insurance carrier, but maybe they're in different plans, and so therefore the rates negotiated in those plans are going to be different, and so there might be different fees. So if you want to call the doctor's office or a hospital and say, hey, I'm going to have gallbladder surgery, can you tell me how much it's going to cost? A lot of times they're going to have a little bit of difficulty providing you with an estimate. So what we thought we would do is try to go through a couple of things. So we're going to briefly walk through a few benefit definitions just to help you understand what are those things that potentially could impact you financially when you are going for medical services. This is not the complete comprehensive list, and like I said earlier, this is just kind of a very high-level overview. But at least it'll give us an opportunity to talk about a few of the things within insurance plans that may impact you as far as any dollars out that you need to spend, or in certain circumstances, dollars that you may be able to put aside to help you save money. The one thing I do want to preface is that, you know, even though we, Gatehouse Media, our medical coverage is through Excellus Blue Cross Blue Shield, a lot of these definitions are similar in other insurance carriers, not the dollar amounts, but the terminology. So even if you are not enrolled in our medical plan, it's good for you to have an understanding of what some of the terminology is, and then you can go back and look at your medical plan and kind of compare, oh, okay, I understand a little bit more about in-network, out-of-network, how does my medical plan handle that? So with that being said, the first one, the definition that we think is really important that people really have an understanding of is you hear this whole in-network, out-of-network, you know, terminology bantered around. And what that really means is, as I mentioned before, you have insurance carriers who will negotiate with different facilities and different, you know, medical providers. And when a facility or a provider agrees to the conditions that the insurance company has said, so if they're like, okay, you know, this is what we'll reimburse for this amount, and this is what, you know, we kind of expect as far as, you know, how your standards are and that sort of thing, then the doctor and the facility will be considered what's called in-network. And those rates then are agreed upon. And so the insurance carrier is going to, you know, you will have a better chance of being reimbursed or not paying out of pocket any more money than what it was the insurance carrier negotiated. On the other hand, there are certain providers or facilities that decide not to become a part of an insurance carrier's network for whatever reason. Maybe they don't like the rates, maybe it's not within their regional geographic area. You know, there could be several reasons why a provider doesn't choose to be a part of a carrier's network. And in those instances, the insurance carrier is only going to reimburse that doctor a certain amount of money. And then as the consumer, you will be basically on the hook for the remainder of that amount. So it's incredibly important to make sure that your provider or your facility is in network. And we'll talk in a little bit about, you know, the different tools and resources that are available to make how you can find that out ahead of time. Another term, so like I mentioned, you know, these are terms that are very universal within healthcare coverage, but if you see on the right-hand side, there's actual numbers. Those are unique to the Gatehouse Media plans for 2019. But this just gives you an idea that a deductible is an amount that you're going to pay out of pocket before the plan is going to pay anything. So you, when you're budgeting and when you're, you know, if you need testing or if you need prescriptions or, you know, you just need treatment, it's really important to know that there is going to be a set dollar amount that you are going to be responsible for. So again, trying to have tools and resources so you know where you can get the most reasonable price and the best possible service is really important. So a deductible is amount you're going to have to pay before the plan will kick in. A copay, you might be familiar with that term, is in our medical plans at Gatehouse Media, it's only applicable in the PPO enhanced and in basic plans, but a copay is going to be a predetermined set amount that you will be responsible for paying the primary care provider or specialist at the time you receive services. A coinsurance, on the other hand, is a percentage that you're going to be responsible for. So, math is not one of my most favorite things in the world. So an easy way to kind of look at what a coinsurance is our example on the right-hand side here, where we have, this employee, Kathy, and she met her deductible already, and she's going to have a surgery, and the surgery is $1,000. So you will see, based on the plans that we have here at Gatehouse Media, what the percentage is that she would be responsible for, and then what that works out to be. So again, there is a certain amount that Kathy is responsible for paying out of pocket, even after her deductible is met. So when you are trying to determine how to save some money, you're going to want to have an idea of where is it that you're going to get the best possible treatment at the most reasonable cost. So those are some of the important definitions to keep in mind for, when you have dollars that are going out to pay for services. Something that you can do when you're planning for, savings or planning your healthcare expenses is understanding something called pre-tax deductions. And pre-tax deductions are basically when you have dollars that, are taken, utilized from your pay to go towards certain benefits. They are used with pre-tax dollars. So things like your medical premiums that you pay towards your medical insurance, your dental premiums, your vision, and then dollars that you decide to put into either a health, a medical or health savings plan, savings account, so either an HSA or an FSA, and then even with your 401k. These are all dollars that you're putting aside with pre-tax dollars. So what that means basically is that if you're an employee and you earn $40,000 a year and you end up paying $5,000 a year for various, either your premiums or putting some money aside for either retirement or for savings for medical expenses, your gross income for tax purposes will only be $35,000. So it's a nice perk, I guess, to be able to say, okay, these are expenses that I need to pay for, but at least they are pre-tax, and that's just a nice thing as you're planning through some of your savings. And there are two different types of medical type savings plans. One is an HSA, or a health savings account. And basically the nice thing about an HSA is it's yours. Once you open it, this is your account. So you can put dollars aside for current or future IRS qualified healthcare expenses, and this account will stay with you. So if you open it up at one company and you leave that company, that is still your account. You can still access the account, you can still put money into the account, and you can use that as a savings vehicle for even future medical expenses, even into retirement. So it's it's a nice perk. You can only contribute to an HSA if you're enrolled in a qualified high deductible plan. And another nice thing about the HSA is that any unused funds will roll over from year to year. So essentially, like I said, that is your savings account. It's not a use it or lose it account. If you are enrolled in the high deductible, you can contribute the pre-tax dollars. And listed, I won't go through all of them, but listed we have, each year the maximum amount that you can contribute is updated normally by the IRS. And Gatehouse Media normally will make tax-free contributions on a quarterly basis. So for 2019, it was an annual total of $400 for employee only and $800 for employee plus one. And these qualified healthcare expenses can include your out-of-pocket copays, co-insurances, deductibles. So it's a really nice feature to have. You may also be familiar with flexible spending accounts. So this is also a vehicle that allows you to put pre-tax dollars aside to pay for out-of-pocket healthcare or dependent care expenses. So what I'm going to talk about right now is only the healthcare flexible spending account, because we're talking about being a healthcare consumer. If you hear anything about a dependent care flexible spending account, that is for child care purposes. So that's why I'm not talking about it today. If you want to learn more about that, you definitely go out and visit the benefit portal. But the flexible spending account also is governed by the IRS, and it will determine each year what the maximum amount is that you can put into the account. And you can use it for, again, IRS qualified out-of-pocket healthcare expenses, such as your co-pays and your co-insurances, glasses, braces. This account is not yours, so if you leave the company, it does not move with you. It is also a use it or lose it account. Recently the IRS has allowed that if you have funds $500 or less in the account, that will roll over. But if you do have more than $500 in the account, you will lose that. So what's really important for employees who choose to participate in a flexible spending account, which again is a great savings vehicle. It just means that you just have to take a little time prior to enrolling in it and take a look at what are your typical expenses in a calendar year. You know, do you have expenses for maintenance prescriptions? Do you have do you realize, yeah, my kids go to the doctor, at least twice a year, or, that sort of thing. You can use kind of your previous year experience to help you plan for how much money you want to put into your flexible spending account. So again, more detailed information on those are found on the benefits portal. So now you might be going, well, how does that help? Because, we didn't sign up for Benefit Definition 101. And again, I think I went through that rather quickly, and I didn't give a lot of detailed information as far as the definitions. But the reason that we felt it was important for you to at least have an understanding of the definitions prior to trying to understand how to be a better healthcare consumer is, again, understanding what are you responsible for. And so you have certain things that are most likely going to happen. You're going to have planned doctor's visits, right? Maybe, you should at least have a relationship, hopefully, with your doctor, that you're seeing them on an annual basis for your healthy visits. But, most of us will end up seeing the doctor, at least for ourselves or for a family member. So a couple of the things that you really can do, obviously, is make sure your provider is in network. And I have Excelis written down because, again, Excelis is the medical provider for Gatehouse, the insurance carrier for Gatehouse Media. But you can, if you have a different insurance carrier, they will also give you tools and resources to make sure that you can find out if your provider and facility is in network. At Gatehouse, for employees who are enrolled in Excelis, we are also lucky that we have the benefit of TouchCare. TouchCare has information regarding our plan, and they are able actually to do research for us to find out, is your provider in network? And they also have other benefits that we'll talk about in a little bit. If you're at the doctor's office and your doctor recommends tests, again, we'll talk about this in a minute, but it's okay to ask questions. So it's okay to get a little more detailed information on the test, asking, the purpose of the test and the timing. So, and then knowing whether or not it's something that needs to be done immediately, or is it something that, can wait to allow you to do a little research? I'll give you an example. I went to the pediatrician recently with my daughter. She had walking pneumonia back in February. And, still has been having a little bit of trouble breathing just when she runs. So we went to the doctor, and the doctor said, probably she sounds good. She probably is okay, but we should get an x-ray just to make sure. And in the past, I would have said, oh, okay, thank you very much, and scheduled it immediately upon checking out. But this time I said, okay, I'm going to be a big girl. And I said, you know, sounds good. Definitely should make sure her lungs are doing okay. Is this something that needs to be done immediately? Or is this something, you know, that can wait? You know, what would be the urgency as far as the timing? And the pediatrician said, you know what, she has her well child visit coming up in December. Why don't we try to get it done before then? And I went, oh, okay, so that made me happy because I like having time frames. But then when I was checking out and the receptionist asked me if I wanted to go ahead and schedule the X-ray, I said, no, I think I will go ahead and I would like to get in touch with, you know, I explained to them what touch care was and see if they can help me get that scheduled. So it just felt a little more empowering that I didn't feel like I had to make that decision right then and there, and it will give me a chance to find out where is going to be the right place to take my daughter. Same thing with prescriptions-ish. So in most medical plans, you're going to find that prescriptions are going to come in tiered levels. So you're going to have your generic, which is going to be your least expensive, your mid-level, and then you're going to have your newer prescriptions, which are going to be higher priced. There are different ways that you can try to save money. You can always ask your doctor, you know, is there a generic for this particular prescription? What are the pros and cons of the generic? You know, most plans have a mail order option. You probably also see advertised on TV quite frequently, different prescription discount programs that you can participate in. And again, Touch Care too also has an RX service that will help you kind of compare costs at different pharmacies and also help you potentially participate in one of those discount rates for certain prescriptions. The one thing we always just want to make sure that everybody is educated on is that any of those discounted programs that you go through, either the Touch Care one or the ones you might see on TV, you most likely, when you go through those programs, the prescription will not end up going through your insurance. So on the one hand, it saves you money. On the other hand, the money for that prescription will not apply to your deductible. So it's just really important to know that if you're somebody who is counting on meeting your deductible for that year, or if you're somebody who normally meets your deductible in the year, just understanding that going through some of those discount programs, you will not have that applied. And that might be fine, and it's not a big deal. Another thing to keep in mind too is your doctor sometimes might not know all the different medications or the different prices, but your pharmacist might. And I know this is not the Sarah show, but another really interesting thing happened to me when it came to prescriptions. My daughter needs a maintenance medication, and I think we were spending like anywhere between $50 and $70 a month to get her prescriptions. And, you know, it hurts. I mean, you're just kind of like, okay, I know she needs it, but, you know, ouch. And, you know, one day I went in to go pick up the prescription, and it was actually the pharmacy associate who looked at me and he said, you know, you're paying more money for this medication because it's a tablet. And there is a less expensive exact, you know, medication that's a capsule. And I said, what? I was shocked. And so basically he gave me the information. I got in touch with the pediatrician and I said, did you know? And she said, why, no, I did not. So she did some research and found out that, you know, there are some medications, right, that have to be in a tablet because you have to break it or, you know, for whatever reason. But this particular medication and her dosage did not need to be in a tablet. So we went from paying, like I said, $50 to $70 a month to paying $15 a month. And, it was just because of that one associate. And that was an eye opener for me to say, if I'm paying an awful lot of money for a prescription, I wonder if the pharmacist would be a good resource to kind of talk about what might be some options. So just a little food for thought. So it's okay to ask questions. And I don't know about you, but I have, and I still do, and I have such a respect for medical professionals. They are, they're brilliant, right? And I've always been a little intimidated to ask questions because what do I know? Google, so it's one of those things that I've had to get comfortable with the idea that it's okay for me to ask questions. I'm in no way challenging the doctor. I'm not telling the doctor that I have this Google information and I think that it's smarter than the doctor. But I also know my body. I know what symptoms I have, and I want to also know just what's going on. And so again, we're not looking to confront, we're learning to learn, or we're looking to learn. So it's okay to say, well, can you give me a little more information? Do you know what my diagnosis is? Can you tell me, what are you hoping to find out with the test? How long does it take to get the results? Do I need to change my daily routine? It's okay, because I think the doctor really wants you to be engaged in your healthcare. And you are going to be your best advocate. You are the person who understands your health the best. And the same thing with prescriptions. We've gotten into a habit where, if a doctor says, hey, I think this prescription is going to work, we're like, okie doke. And, maybe I just want to understand a little bit more before I put anything into my body. So, what are the side effects? How is the medication supposed to help me? What happens if I have an issue with this medication? Are there other possibilities available? I know a lot of times, you'll see the statistics and it'll say, oh, only 1 in, 100 people have a reaction to this. And I don't know about you, but I've been that 100th person sometimes where I've had a negative reaction to a medication. So it's just nice to know, okay, if this doesn't work and I'm experiencing X, I know that there are other alternatives. And then as far as pain pills go, I think we're all aware of what's going on with pain pills. And it's really important, I can't stress enough, having an honest dialogue with your doctor about this. And asking something as simple as, at what level of pain should I take this prescription? If you've ever had pain management before, that, they rate it on a scale of 1 to 10, with 10 being the worst. Maybe on some circumstances up to a 6 or a 7, the doctor might say, thanks for asking that. Maybe, up until that point, try to manage the pain with Motrin or, ibuprofen or whatever. And then once it gets to a certain point, that's when I would expect you to take, this medication. Or, what happens if I don't? Do I have to take all of the medication? Because we're all programmed that you have to finish all the medication you were prescribed. Well, maybe that's not applicable for this type of medication. And then really huge is you, again, are your best advocate. So if you've had any history of addictive behaviors, or if you've had alcohol or drug issues in the past, or if you live with anybody who does. And it's okay, your doctor is not there to judge you, your doctor is there to help you. And it's really important to make sure that you're sharing that information, because if you do have an addictive personality, or if you live with somebody who has an addictive personality, maybe this medication isn't, the best choice, and what other options might be available. Nobody likes to think about a procedure. Nobody likes to say, hey, you know what, I think in a couple of months I'm going to go ahead and get my gallbladder, removed. But there's always a possibility. So it's good to know, prior to having a surgery. So again, if the doctor says to you, okay, I think you're gonna need to get an MRI and do XYZ or whatever it is the doctor is recommending. it's good to, before you book anything, again, just find out who's in network. It's going to make a huge difference in what you end up paying out of pocket. And one thing that's really huge to understand is just because you might be paying less money at facility X versus facility Y, it does not mean the quality is substandard. It's just, again, most likely comes down to the negotiated contracts of the insurance carriers. So, you know, again, knowing which urgent cares in your area are in network. These are things that, you know, if you have on your refrigerator, you know, if you need it, you're going to go to urgent care X. And we're going to talk in a minute about MD Live just as an alternative to urgent care if you ever need it. For those of our employees who are enrolled in Excellus Blue Cross Blue Shield, you can create, you can find out if a provider is in network very easily. You can either call them, and if you don't have time or the ability to write this number down right now, that number should be on your card, on your subscriber identification card. You also can go on to excellusbcbs.com, create an account, and then you're going to be able to find these resources, find a doctor or a provider. And then they've also got a resource area as well where you can find out estimated treatment costs. This is a great resource to have either way, whether or not you're looking for a doctor, because there's a lot of information out when, you know, if you go ahead and create an account on this site, it's a really great resource for you to have. For those of you who are not members of Excellus, I am willing to bet that your insurance carrier is also going to have a resource area where you can find out if your providers or what providers in your area are in network or out of network. For those of our employees who are in the Excellus Blue Cross Blue Shield medical plan, we do have Touch Care, and Touch Care is a benefit that's provided to you at no cost. And basically, it's kind of like having your own concierge service when it comes to healthcare. You can give them a call or contact them either through the app or on their website, and they can help you not only find out what providers are in network. They can help you if you do need an MRI or an X-ray. Like I said earlier, for my daughter, I'm going to call them to find out what's going to be the best facility to go to. You know, I'd like to find someplace maybe that's child friendly. I'd like to find someplace that, you know, I'm not going to be charged an arm and a leg, you know. So if you need help with prescriptions, like I said earlier. So there's a lot of perks to remembering that Touch Care is there as a resource. Another thing too to keep in mind is they can actually schedule your appointments for you. So you can give them a call and say, I don't want to be on hold for like 10 hours trying to get an eye appointment. You know, these are the dates that are good for me. Can you help me out? You know, so that they really are a concierge service. So it's very nice. Something that all employees can register for is something called MD Live. The fees for the MD Live services will be different depending on your insurance coverage. So again, you know, negotiated fees, but it is something that all employees can participate in. And basically what MD Live is it is an alternative to urgent care for non-emergency situations. So if you have a situation like, let's say, you know, you think you have pink eye, or, you know, you think your child has, you know, an ear infection or something that is happening at a time where it's either inconvenient to get to your primary care physician, or you're traveling, and you don't want to go to urgent care or the actual emergency department for something like that. MD Live is a service that you can contact them 24/7, 365. You'll be put in touch with a licensed medical provider who can, you know, write prescriptions, and they can treat you either over the phone, through their app, or through their internet site. One feature of MD Live that I really would be remiss not to mention is they do have a behavioral health service. Now, what I was just talking about a minute ago was more like urgent care, so it's not somebody that you would expect to see on a regular basis. Their behavioral health, if you've ever needed to talk to a behavioral health specialist or know somebody who has, you know that sometimes it can be difficult to get in to see somebody. Sometimes their office hours or during our working hours, you know, so sometimes it's just really difficult to get in to see somebody. So what they have is through MD Live, you can be connected with a behavioral health specialist, a variety of specialties too. So they do have psychiatrists if there's any medical management that's or pharmacological management that's needed. And then there's different levels, you know, psychologists and social workers and that sort of thing. And you will see the same person on a regular basis, and you can see that person when it's convenient for you and where it's convenient for you. So you can see that person from your house. You can see that person, you know, wherever it is you want to connect with that person. So that's just a nice feature that I want to make sure everyone's aware of. And on our Simply Good Life YouTube channel, we do have a video that does a few videos that talk about the MD Live feature benefit that we have. So in summary, you know, it's really just, it's hard because the answers aren't easily accessible. And so if you have an idea of what it is you're responsible for as far as paying, and then knowing where you can go to get some of the information you need to compare costs and services, it's going to help a bit. I mean, unfortunately, we're, you know, all responsible for, you know, whatever expenses, but it doesn't mean we have to pay, that we are completely helpless when it comes to what we're paying. Having an emergency plan is helpful as well. You know, again, knowing maybe which urgent cares in your area are in network, or, you know, signing up ahead of time for something like MD Live, you know, in case you do need some sort of service. Knowing that it's okay to ask questions, maybe having a couple questions in your hip pocket, and then please utilize the resources and services that are free. You know, so again, for us, people who are registered or enrolled in Excelis Blue Cross Blue Shield, knowing that you can go to Excelis for information. You have Touch Care. We have other resources on our benefits portal. And I can't emphasize enough, if you're not in Excelis, please check with your medical insurance carrier, because they are going to have resources as well. And this information, I'm not going to read it, you know, but this is all accessible to you again on our portal. So we have Excelis, Touch Care, MD Live. And then if you do have questions or information that you'd like to share or feedback that you'd like to give to the wellness program, we can be reached at ghmwellness@gatehousemedia.com. So that is it for today. I do appreciate everybody, you know, joining in today. I hope you're able to take a little something away from that. And next month, we will be talking about one of my most favorite topics, not really, cold and flu, and different steps that you can take to try to understand the difference between the two, and different steps that you can take to try to minimize your risk of getting sick. So again, thank you guys. Please have a healthy and safe Labor Day weekend, and I will talk to you soon.